Sepsis. The top 3 manifestations: change in mental status, lethargy, or agitation, systolic blood pressure less than 100 millimeters of mercury, or a MAP less than 65, which is much more accurate. A respiratory rate of greater than 22 breaths a minute, but a lot of times by the time you realize something's wrong, it's more like 30 breaths per minute. You can remember other manifestations of sepsis using the acronym Sepsis. S for shivering, fever, or low temperature. E for extreme pain or general discomfort. P for pale, gray, or mottled skin. S for sleepy, slurred speech, lethargy, or confusion. I, impending doom, I feel like I might die. And S, shortness of breath or hypoxia. Complications from sepsis include acute respiratory distress syndrome, acute renal failure, and often acute renal failure is just the first of the sequential organ failures that are going to come. And systemic or peripheral blood clots or disseminated intravascular coagulation. Diagnostic interventions that need to be performed within the first 30 minutes that you've recognized that sepsis is occurring. A lactic acid blood draw greater than 2 is pretty bad. Blood cultures ×2 and a portable chest x-ray. Those need to be done immediately. Your first 15 to 30 minutes, those treatments that you can do at the bedside for sepsis, intravenous fluids, so normal saline or lactated ringers, and deliver oxygen to keep their saturations greater than 92 to 94%. Within the next 30 to 60 minutes, you're going to make sure that those blood cultures were done, and then you're going to get antibiotics started. And if those initial measures aren't working well, and your patient's not stabilizing, you're going to do vasopressor drugs like epinephrine or dopamine, and regardless, you're going to very closely manage urine output. 30 milliliters per hour or less, kidneys are in distress.